It's now my real pleasure to introduce my colleague on the Public Policy Network, the Reverend Diane Fadley, who will introduce our initiatives with healthcare and our specialist.
Okay. I'm going to be introducing today very warmly with a warm welcome, Mr. Vinny DeMarco of the Maryland Healthcare for All Coalition and the president of the Healthcare for All Coalition's, the parent program for that is the Maryland Citizens Health Initiative, and Vinny DeMarco is its president. Also with him, we might be seeing today Catherine Kirk-Robbins, the Deputy Director for Prescription Drug Affordability Issues. These organizations are intimately connected to very important healthcare advocacy and health equity issues and legislation in our state. The work that Vinny DeMarco has done is phenomenal throughout his very long life as an advocate for healthcare and health equity. It's going to be very interesting to hear what you have to say, Vinny, and I'm looking forward to it, and I know we all are.
Hi.
Hi. You're very warmly welcome to our.
Thank you, Diane.
Yes, and we are all ears to hear about what you have to share with us. I've given a little teeny weeny snippet of what you do to everyone, and I know you have plenty to tell us. Thank you.
Well, thank you. It's always a pleasure, Diane, to be here with the Episcopal Diocese of Maryland and all your colleagues. I'm a big fan of yours, and Kathy and Ken and Carrie, you've all done a great job of setting this up. And Bishop Sutton, your prayer was so beautiful this morning. You are just an incredible human. I am thrilled to be here to talk with you a little bit about the 2021 session. I wish we were in person. Like many of you, I'm a hugger, and I miss that. It's a different world we live in. But this pandemic we're in has highlighted the need for progress in healthcare. And I see Bishop Imhoff there. I want to thank him for all he did working with us years ago that laid the foundation for some of the progress we're doing now. And I'm thrilled you're back with the diocese, as I heard this morning.
Yes. And Vinny, this Bishop Sutton here. I just gotta let people know, Vinny and I have breakfast frequently. I work for Vinny. He's not paid, and I want some pay there too. But Vinny has just been a good friend of the diocese, a good friend of all who are in need of some help in Maryland. And so, if you were an Episcopalian, I'd make you a saint.
Well, I know there's some people who would dispute that, but thank you. Thank you, Bishop, very, very much. And, as you all know on this call, in addition to health equity and health justice and healthcare for all, the Episcopal Diocese has played a critical role on other issues I've worked on, reducing gun violence and protecting our climate. And on all those issues, we've made tremendous progress with Bishop Sutton's leadership. In 2019, Maryland increased the percentage of our energy that's renewable from 25 to 50%, the Clean Energy Jobs Act. And now my son, Jamie DeMarco, is working on the Climate Solutions Now Act, which is something I'd urge you to take a look at, which I think is going to hopefully pass this year to build on that. But, as I was saying, the pandemic has highlighted just the terrible healthcare problems that many Marylanders and Americans have, as well as the disparities. And Bishop Sutton, you were so moving this morning in talking about the need to take on and address racial disparities and racial inequities. And we see them loud and clear in healthcare. And one of our main pieces of legislation deals directly with that, but all of the work we're doing does that. But before I talk about the 2021 session, I just want to thank you so much for the progress we've made in Maryland over the last couple of years in leading the way on healthcare. for several years, as you know, we and others like us around the country were battling to protect the Affordable Care Act from attacks at the federal level. Those are behind us. President Biden, Vice President Harris, and the Congress are committed to protecting the Affordable Care Act and building on it at the national level. And the bill that's going to pass pretty soon, the National COVID Relief Law, has more in it to help people afford their health care. So that's great. So that gives us more opportunity to move forward with the federal government now going in the forward direction on health care. But in 2019, with a lot of support from the faith community, Maryland enacted 2 laws which are national models. One, the easy enrollment health insurance program became Maryland the first state where at tax time, you're asked, are you uninsured? If you say yes, you're asked, can we, the comptroller, share your information with the health exchange to get you insured? 50,000 people checked that box, and many thousands got health care who were eligible for free or low-cost health care but didn't know about it. And that's happening again this year, and that'll happen every year. Several states are following our lead on that, and Chris Van Hollen is going to put in a national easy enrollment law. So that easy enrollment health law that you helped get enacted in 2019 is really working in Maryland and going elsewhere. In addition, and this could not have happened without your support, we enacted the first in the nation prescription drug affordability board. There were hundreds of pharma lobbyists swarming all over Annapolis trying to block it, but they couldn't because they were up against Bishop Sutton. And no matter how many hundreds of lobbyists, you can't beat Bishop Sutton. And the law passed, and now it's in progress working. And this year, this legislature overturned a veto the governor made of a funding bill for that. So it's working. And about a dozen states are trying to replicate that. And Senator Chris Van Hollen is putting in a bill at the national level along those lines. So 2019 successes are really, really stupendous. But we need to build on those. And we have 3 pieces of legislation this year to build on the successes. One is easy enrollment worked so well. Why don't we do the same thing that we're doing now at tax time when people file for unemployment insurance? When we did focus groups, we found many people who are uninsured but eligible for low-cost health care saying that's the best time to catch us when we lose our jobs and lose our health insurance. So a bill by Delegate Lori Charkoudian, HB 1002, and Senator Jim Rosapep, SB 893, among other things on unemployment. There are broader bills, but they have a provision saying that when you file for unemployment insurance, you will be connected to the health exchange. And we think you'll find a lot more people to get insured through that. A very important law. Please chime in on that. Second, we know that there are people above the Medicaid level, above the level where they get full subsidies, who still can't afford health care. Maryland, we have insured 400,000 people, but there's still 300,000 or 400,000 people uninsured. Many of them will find through easy enrollment, but there's still some people who still need it. They're going to be helped by the federal law, but we want to have some state subsidies. Massachusetts has state subsidies, and their uninsurance rate is 3% as opposed to our 6%. And another bill by Delegate Ken Kerr, House Bill 780, and a similar bill in the Senate by Senator Brian Feldman, will provide $20 million for additional subsidies for young people who can't afford their health care. And getting those people insured will help bring all our premiums down for everybody. So those are 2 very important bills. But the third, probably our most important measure this year, is the Health Equity Resource Communities. Health Equity Resource Communities. House Bill 463 by Delegates Eric Barron and Jazz Lewis, and Senate Bill 172 by Senator Antonio Hayes. In 2012, Maryland enacted a health enterprise zones under Governor O'Malley, Lieutenant Governor Brown, which was working very well to, in a targeted way, provide health care for people. That was lapsed in 2017. The Hogan administration didn't want to continue it. It was a 5-year pilot. Very sad. We want to resuscitate it. We want to call it the Health Equity Resource Communities, and we want to make it permanent. So we urge you to contact your legislators to support House Bill 463 and Senate Bill 172. And we're proposing a 1 penny per dollar increase in the alcohol tax to permanently fund it, which, like the one you helped us enact in 2012, will also reduce underage drinking and drunk driving. But we want a permanent funding mechanism for the Health Equity Resource Communities. Those 3 measures would be a trifecta of healthcare in 2021, and we ask your help to get them enacted. And I've talked a long time, so I'd be happy to answer questions or anything else you need. Diane or anybody?
Hi, Vincent. This is Bernadette Roach. I'm curious if there's any initiatives with your group that relate to environmental health issues where, the environmental degradation from, for example, the waste incineration emissions and that sort of thing. Is there any focus on environmental health? Thanks.
It's a good question, and thanks for your chat about it. Easy enrollment rocks. Appreciate that. We do not. Our organization, Healthcare for All Maryland Citizen Health Initiative, our charter is narrowed to healthcare coverage and people getting health care. Although we know what you're talking about is very real. And my son's organization, the Chesapeake Climate Action Network, focuses on those issues, and they're working on the Climate Solutions Act now, and they're trying to stop the subsidies that incinerator. So I would urge you to connect with Jamie DeMarco and Mike Tidwell at Chesapeake Climate Action Network.
I wrote to Ken and Chris that addiction is a health problem as well.
Yes.
And it segues into other health problems that are neglected due to the addiction. They include dental, high blood pressure, prenatal care, gynecological care, and what is being done to provide affordable addiction treatment?
It's an excellent question, and our proposals in House Bill 463 and Senate Bill 172 authorizes between $1 and $2 million directly into behavioral health and to help with those issues. In addition, we believe that when we create the health equity resource communities, if a community has a plan that deals with addressing addiction issues, that would make it a smart proposal to put in to get resources under the health equity resource communities. So House Bill 463 and Senate Bill 172 directly address behavioral health. So another reason to comment on those bills, but thank you. Very important comment. Yes.
So I'm curious, in your work on providing, getting more people insured, have you ever looked into how we actually add dental coverage to the whole concept of medical care? Because it's very challenging if you're not, if your employer doesn't provide dental insurance, it's really challenging to get that.
Yes, it's a great question, and we are strong believers in dental care being fully covered. It's true that in Medicaid covers dental for children very well, but not adults, and that's a problem. And it's a question of resources, but we think resources should be put in there to do adult dental. And there are organizations more directly working on that, which we're supportive. Above the Medicaid level, most of the Affordable Care Act plans that people sign up do have dental coverage. They vary, but they have dental coverage. But your basic point is a very important one, and one that we're committed to, is putting full dental coverage, especially in Medicaid. Thank you.
Any other questions? Thank you so very much, Vinny. We appreciate you every time you join us very much. Thank you so much.